Okay, so welcome back to this visual lecture series. We are discussing about the 11 key areas of responsibilities and with its corresponding core competencies. And we have here the first competency, safety, and quality. Okay, so this first area of nursing responsibility is focused on the provision of nursing care that is safe and of quality, highest quality. Okay, the best service that you can give to your patient, to the families, their clientele. And according to the symbol, under this key area of responsibility is the competencies include demonstration of knowledge, of skills, mastery of the status of the patient, whether it's well or ill, um, appropriate decisions that you're going to do in the case of a patient involving their families, and of course ensuring the safety, the privacy, the comfort of your patients, of their families, um, setting priorities in relation to your nursing care plan, nursing care process, um, working with the team, with your colleagues to ensure the stable quality care is provided effectively, and other services that are deemed necessary um, to be given of quality and following the standards and guidelines of the nursing practice. Okay, so this is the first um, key area of responsibility with the corresponding uh, competencies. Okay, so I hope you can see this clearly. So first, care of responsibility, safe and quality care. So we have here on the left of your screen are the core competency, and on the right are the indicators. So when you say indicators, what this is the things that indicate that you are having the competency. These are the manifestations that you have. These are the suggestions that you have the competency. These are the what are the other words? The cues, the leads of the competency. Okay. So first core competency, we have demonstrate knowledge based on health or illness status of individual or groups. So what are the indicators that you have these core competencies? First, you identify the health needs, the status of your patients, of the groups, and you are able, okay, to explain the patient or the group status, the family status, the community status. When you say patient, we are not we are referring to the patient in the hospital, and I think when you say group is you're referring to other clienteles, okay, especially families, the larger community. Okay, so if you're able to explain, you're able to show mastery of the status of your clienteles, you are manifesting the indicators for core competency number one under safe and quality care, which is demonstration of knowledge, okay, of the client status. Then for core competency number two, provides sound decision or good decision making in care of individual or groups considering their beliefs, their values. So what are indicators that you're meeting this core competency? You're able to identify problems, okay, of your clients. You can gather data related to the problem, analyze it, then you make some appropriate interventions. you monitor the progress of action, or you evaluate, and um, you you carry out necessary intervention implementations or changes with your evaluation. So it's like into your nursing care plan, regardless of the patient, of the group or clients that you have, you follow this process. So when you can do this or exhibit these indicators, you are meeting core competency number 2, which is you decide or you make decisions soundly, okay, and systematically. You really study it, you study the situation, you study the condition, and that's for number 2. Number 3, promotes patient safety and comfort. Okay, so you perform age-specific um, measures and comfort measure in all aspects of patient care. Okay, so of course that would be one of our top priorities, okay, if not the priority. So the safety and comfort of your patients. Okay, you do interventions, you do actions that also considers the safety of your patient. Okay, if ever the intervention is not for safety per se, but all other interventions should be done with safety, okay, and comfort. Okay, that's why every time you do procedures, you always ensure the safety and the comfort of your client. Then number 4, priority setting and nursing care based on your patient's needs. Okay, so it's always based on the patient's needs. It's always based on the status of your clients. So it's not on the comfort of the nurse. It should be on the comfort, on the status, on the condition of the patient. Okay, so you should know how to identify the priority needs of the patient, analyze it, study it, and determine appropriate nursing care to be provided to meet the needs of your client. Okay, so that is core competency number 4 under safe and quality care. And we have number 5, ensure continuity of care, of quality care, not only care but quality care. Okay, it refers to identified problems to appropriate identified problems to appropriate individuals or agencies. Okay, it can be your colleagues, nurses, or doctors, or other departments, or your supervisors. Okay, to ensure continuity of care, establish means of providing continuous patient care. Okay, that's very evident in the nursing profession, especially as an example, though it's practiced also elsewhere. In the clinical setting, we have these referrals, we have these endorsements, okay, verbally or written, okay. So these are ways to ensure that the provision of care is continuous. Then number 6, administers medications and other health therapeutics. Okay. Conforms to the 10 golden rules in medication administration. Okay, your 10 rights and 10 R's for other references. Okay, so you should keep that in mind when you do medication administration. Issues, I think, taught in your pharmacology and fundamentals. Okay, and of course in your REDs. Then, competency number 7 utilizes the nursing process as framework for nursing. Okay, performs comprehensive, systematic, and nursing assessment. Okay, so that is the principle of nursing care process. Okay, to have a systematic way of addressing the needs of your um, clients. Okay, um, under these competencies, we have these indicators. You should obtain consent, complete appropriate assessment forms, perform effective assessment techniques, comprehensive client information, maintains privacy and confidentiality, and identifies the help needs. Okay, so the in number 7, assessment is emphasized because that's the very foundation of your uh, care plan, your care process. Okay, very good assessment will can yield or can lead to very good action and a very good effect to your clients. Okay, then number 8, next to assessment is formulation of your care plan in collaboration with patients and other health team members. This is hinted by including patient, family, and care planning, states expected outcomes. Um, in nursing interventions, you can develop comprehensive patient care plan and accomplish patient-centered discharge plan. Okay? When you have your RIDs on your second year, you'll be taught on how to do actual care plans. Although I think you can be taught already or already taught during your first year in your fundamentals of nursing in I don't know how your school approach this uh, topic, but once you are, let's say, first year student, um, throughout your 4 years, okay, you'll be making countless of nursing care plans. Okay, you'll be asked countless care plans, prioritized care plans. There would be some institutions or some instructors will be asking you every day or every duty day to make at least 5 care plans. Okay, then tomorrow another 5 care plans. Okay, which is very important because this will shape you. Um, this will really mold you on becoming a very good nurse. And number 9, implements NCP to achieve identified outcomes. Okay, so and number 10, if I may just fuse the two, implements NCP progress toward expected outcomes. Okay, for number 9, we are referring to the actions, the nursing actions, the interventions. These are actions, these are interventions to correct, okay, the problem. Okay, for example, if your patient has fever, okay, what are your implementations? What are your actions to correct or to meet the expected outcome, which is to decrease the normal temperature at the high temperature of your client. Okay, so explain the interventions to the patient, the family before carrying them out. So you orient them. That's one way of building trust with your client, orienting them always, giving them the knowledge of what is going to happen and what is expected of them or from them. Implement safe, comfortable nursing interventions, always a priority. Acts according to the client's health conditions, needs. Again, it's always based on the status of the client, but not on your preference. Okay? Not on your comfort, okay, as the one implementing the actions. Although it can be possible, but you should prioritize things. Okay? Performs nursing interventions effectively and in a timely manner. Okay? And number 10, you already monitor the effectiveness of your nursing interventions. Have you met? Okay? Or how can you say that your actions were effective? You evaluate. Okay? You go back to the patient, you ask the patient, or you assess, or you not really assess, so as not to confuse you. Get evidences, um, get proofs that your actions corrected the problem. Just like in my previous example, fever, that means high temperature. Uh, Maybe you give sponge bath, you give healthy changes like, increasing fluid intake, uh, changing clothes into lighter ones, and etc. Don't need it. Then how will you know? Get the temperature again. Okay, that's how you monitor the effectiveness of that problem. Okay, so this is in your NCP, in your nursing care process, this is like your evaluation. Okay, and if ever you're not successful, okay, in our NCP we call this unmet goals. Okay, you revise your care plan, okay, as needed. Okay, PRN as needed. Okay, so um, you should be flexible. Okay, you should be patient as a nurse. uh, there should be several solutions, okay, so that if plan A didn't work, we can go for plan B, plan C, and hoping plan D, as early as plan B, it will be corrected, it will be effective, more effective than your plan A, because you're dealing with people here, with lives here. Okay, that's why safety and quality care is presented as number one. Okay, the number 11, response to urgency of patient's condition. Okay, and identifies sudden changes in patient's health conditions, implements immediate appropriate interventions. So the word here is responding urgently. Okay, so you have that sense of urgency, as references would state it. Okay, um, you can have that clinical eye to work with your patient. You can urgently see the problem and to act accordingly. Okay, it's, you know that you'll be lax in this profession, especially dealing with patients. Okay, so if you cannot do it alone, you may ask, okay, help of your colleagues. But it's important to have that sense of urgency, have that clinical eye, have that observe. You're a keen observer, okay, of the changes in your patient's conditions. Okay, so, and knowing the conditions, what are the appropriate immediate interventions to provide or to implement. Okay, so that is key area responsibility number one: safety and quality care. Safe and quality care, or safety and quality. Okay, and these are the corresponding core competencies. And I hope, okay, you imbibe them, you develop them, okay, together with the rest of the 10 that I'll be um, discussing in the next video lecture series. Again, do not forget to subscribe and to share this to your colleagues. Thank you so much. See you in the next video lecture.